New Hope Clinic is an independent 501c3 nonprofit organization that provides quality medical, dental, and pharmacy services to low-income, uninsured Brunswick County adults in a caring, patient-centered setting.
It didn't start until the evening. I'm trying to, probably 5 or 6, I can't remember exactly what time. But people would start coming at 3 or so to sign in. And we were here until 11 and 12 o'clock at night.
I've been working with New Hope Clinic for 18 years. In fact, when I first started working at the clinic, we didn't have a nice pharmacy like this. We used to be over at Century Storage Park, and actually we were in a janitor's closet.
We're so thankful for those who saw the need to start New Hope Clinic in 1998.
Dr. Amaral actually told me about the clinic, and I volunteered here starting then, and then I'd say probably 2 years later I became the medical director, so I've probably been the medical director for about 15 years.
We worked together to, I guess it was in 2001, establish the dental clinic, and began with just a single room, and we've now moved to 2 rooms, and it's completely volunteer operated, and we now serve 3 to 8 clinics, 155 patients this last year, and over 388 dental visits.
There are a lot of people who have no insurance, no funds. They're not covered by any government program. They kind of fall through the cracks. And a good number of these people have chronic diseases that it makes them very difficult to get a job. Some of them can't work, even if they wanted to work, to get the kind of job they want.
These folks would be using the emergency room, even if that would be an option, or they'd be going without mental care. One of the things that I see a lot that people talk to me a lot about is dental care, because they have dental issues and can't find a dentist that will see them. So if they have issues, they end up in the emergency room also.
New Hope Clinic is the first link to our men that come into our program, getting their physical health in order. One of our greatest success stories is a man that came in to us near death. And today, through the help of New Hope Clinic, that man is living independently. He has been transformed from a homeless man to a man who lives in his own home.
New Hope Clinic is one of the great resources here in the community, and it's really a gem to those community members who need to seek care. And they provide a great number of resources to those community members. And for us here at Brunswick Medical Center, it's a great partnership. Patients come to us in need, and then we refer them to New Hope, and then they follow up on their care and do a lot of managed care, and it helps keep them out of our EDs so that our ED is available for those who have a true emergency need and a visit that we can take care of there. So it is a great partnership for us, and we look forward to many more years together.
One of the things that I think is neat about working at the clinic is that we have a lot of people who have been here as volunteers for a long, long time. They're really committed. They look forward to the camaraderie of with the other people that they work with, and I think they look forward to, a 3 or 4 hour shift of accomplishing something for somebody else.
I went to the health department, and the health department sent me here because my insulin was so expensive. So that was mainly my main reason for coming, because I couldn't afford my insulin no more.
How much they thank you. They are just so grateful that we're here, that we help them. And many times if they go on Medicare or something else, they're so sorry to see us go, and that they really want to stay, but we have to tell them that they have.
We serve almost 1,000 individuals every year. We estimate there's almost 10,000 more who could need our services based on their lack of health insurance and their low income. So it's important that you all are our voice in the community. If you know someone who's going without their health care because they don't think they can afford it, send them to us. We might not be the right answer, but we have lots of resources that we can get someone connected to. And being here in Shallotte with Brunswick Family Assistance helps us address other areas of an individual's life as well. patient walks into our exam room, talks to our nurse, talks to our nurse practitioner, and we identify a housing problem or a food access problem. We have food right here. So our community works together. We all use the resources we have to help those who are less fortunate. And if we can spread the word more, we can do even more.
As the president of Dosher Hospital, I can tell you how important New Hope Clinic is to our community and to the patients that don't have access to care except for coming to the emergency room. They're a critical provider of health services and very much needed by our hospital, by our physicians, and a valued part of the healthcare professional team here in Southport.
The services offered by New Hope Clinic are absolutely vital to the overall health of our community. Without New Hope, many of our most at-risk citizens would not have access to vital health care.
I wasn't able to obtain medical insurance, and disability is pending, and Medicaid is not covered for me. And so this is it's like a saving grace for me.
What's important is to have a resource for our community, and without insurance we would not necessarily receive medical care, and and having a healthy community makes for a safer community.
We are here to celebrate the New Hope Clinic, 20 years servicing the Brunswick County community, and almost 3 years servicing the southern part of the county. And as the Chamber of Commerce, we know what the need is in the community. It goes way beyond what the business needs are. It's what our business owners need, their families need. And we're so blessed and thankful that New Hope Clinic is here in our southern area, servicing our individuals here a few days a week. And they're continuing to grow. We hope to see them here for another 20 years.
My granddaddy used to build shrimp boats over the beach, and I owned some. My daddy owned shrimp boats. I worked on them. I actually went to college at Cape Fear Community College years ago for the commercial fishing program. And, I was going to make my living commercial fishing most of my life, was my plan. And I done that. Commercial fishing has no health insurance. I went working on tugboats. Generally, they have no health insurance. I worked at a boatyard for years. We tried to get health insurance with 8 employees. Not one employee could afford it.
I was afraid when I first got here because it's a stigma that you don't want to be seen as I need help. I'm a big guy, I take care of myself. Well, that was kind of a lie, and I couldn't take care of myself, and I needed help. I wasn't going to get it any other way, so I needed help. And you have to be brave enough to say, I need help. So don't let fear hold you back. It's not an option.
We're so thankful to all those who have given over the years their time, their treasures, and their talents. But the need is even greater. There's so much more we can do to make sure Brunswick County is a healthier place to live.